both are doing and have been doing. We're going to move to our student panel now, Interprofessional Trainee and Student Panel. I'm going to welcome Amy Ramirez to the stage. Amy, from here on, this is your panel. Thank you for joining us, everyone.
Thank you. I see some of our students are getting into the stage. So I just want to say good morning to everybody while students are coming on to the screen. And, say thank you again to Dr. So and Dr. Benawahu for your incredibly inspiring and empowering words this morning. Where we were so happy with what happened yesterday. And already I can see that today's session is going to be nothing short of powerful and amazing. As Carlos mentioned earlier yesterday, we heard from a group of students and trainees in some of our health professional programs about what decolonization means to them in the practice of their profession and their education. And today we're switching the professions and fields of study a little bit. So I have the pleasure of moderating a panel of students that includes folks from social work, public health, law, the graduate school, as well as the School of Medicine. Very excited about the interprofessional opportunities presented in this discussion today. So before we begin with some of the guided questions that we drafted and prepared in advance, I'm going to ask the students to say hello to the audience as I introduce the different learning groups that each of you were a part of, and to acknowledge the role of faculty members that were so instrumental in creating a conversation about what decolonization means within the context of their specific profession or academic field. So to start, we had two different groups from the School of Social Work. Their work was led by Drs. Corey Scheidema and Caroline Long, as well as Sally Bjornholm. Akiva and Lindsay, can you just say hello to the audience, as you'll be representing those two social work groups?
Hello, I'm Lindsay.
Hi, my name is Akiva. It's a pleasure to be here.
Thank you. Next, we had a group of students from the UMB Law School and their partners at the University of Malawi, Chancellor's College. That group was led by Professor Chikosa Banda from the University of Malawi and Professors Bill Permite, Robert Percival, Peter Danchin, and Rebecca Hall at UMB's Law School. Teoka, Asante, and Erica, will you please say hello to the audience?
Hi.
Hi, everyone. It's a pleasure to be here.
Thank you.
Hi, guys. I'm Toga. It's a pleasure to be here.
Thank you so much. Next, we had some students from the graduate school's health science and physician assistant programs, and their group was led by Drs. Fedron Guzman, Dr. Naya Wirtz, Dr. Nicole Wooten, and Dr. Kimberly Bizzle. Rose and Danielle, could you please say hello to the audience?
Hi, everyone.
Hi, Rose. Hi, Danielle. Thank you. We also had a School of Medicine group with some wonderful faculty members that were involved in the work of guiding School of Medicine students. I want to recognize Drs. Adrian Holloway, Rebecca Cray, Miriam Laufer, David Riedel, Mark Travasso, Sabina Laydorf, and Deanna Friedman-Klabanoff. Michael, will you please say hi to everyone?
Hi, pleasure to be here.
Thank you. And last, but certainly not least, we had a group of students in a learning group from the University of Maryland College Park School of Public Health. That group was led by Drs. Liz Mehring and Madhu Kuswaha. Sarah, can you please say hello to the audience?
Hi, everyone. I'm Sahra. I'm very pleased to be here. Thank you.
Thank you so much. So exciting with so much diverse representation of fields and professions and locations around the world. So I'm going to get us started. And I've got a question for Akiva and Rose. because I understand that your learning group was engaged in a very active discussion about the role of structures and systems, including perverse incentives, in maintaining neo-colonial mindsets in professional fields. In your view, what are some of the structures, systems, and incentives that support the continuation of colonial logics inside of professional fields? Akiva or Rose, whichever one of you would like to start.
I can start us off if that's all right.
Sure.
I prepared a little bit, so if I start to go on for too long, I hope you'll stop me.
Sure.
So I wanted to share about one of the distinguishing features of social work, in distinction from classical psychology, being an insistence on the person and environment, or pi theory. I think that this view of individuals and communities within and in relation to the world around them tacitly underlies a lot of the concepts that have been discussed at the summit so far. We do not, after all, consider it the fault of a person disadvantaged by historical systems and contemporary consequences of colonialism. In a historical lens, it makes a great deal of sense to people in other fields of study when this argument is material. That is, when we examine things like current wealth discrepancies that exist along racial lines in the United States as a direct consequence of generational wealth made possible by the kidnapping and enslaving of African peoples by British colonists and later early Americans. We may even extend this argument, incorporating the ideas of the social determinants of health, to explain variable health outcomes that exist along class and race lines in the United States. But this argument too is largely material. And yet our environment includes much more than the material. We exist in relation to others. And I would not call this immaterial, but amaterial. Aspects of our environment, including the air we breathe in our relationships. And because of this, there's a deep and sometimes insidious influence upon our professional behavior. This comprises the conditions that we reproduce simply by moving through the world, unless we identify the aspects we wish to change and work to do so. So a few of the perverse incentives that I wanted to discuss that came up for us: publish or perish. You may have heard this phrase before. It's not lost on any of us that there's an exciting opportunity to publish as a part of this particular conference. And I don't mean to disparage that opportunity. I hope to submit something myself with some peers. But publication is an incentive which, in its nature, often promotes a mindset of individual achievement, which I would say itself is a facet of capitalism in academia, which may be antithetical to a decolonial mindset. This is only one of a number of systems-based incentives. Many universities in the United States, and we've discussed this yesterday a little bit, have explicitly colonial roots, including some parts of the university system of Maryland, established in the Morrill Land Grant Acts of 1862 and 1890. I think that's Maryland Eastern Shore and College Park. Such universities are invested heavily financially in the continuation of their existence and resist strongly any notion that they and we should engage in decolonial practices like land repatriation. We are all complicit in that from a systems perspective. And how we justify that complicity, I think, depends on us individually. And unless we organize to identify ways that we can engage in decolonial work on behalf of our institutions, we're lending our hands to perpetuation of neocolonialism. So sources for funding as well as practice is a final incentive. So we're all probably going to be involved in seeking funding for our work at some point, and those of us who've done so already are intimately familiar with how hard it is to cobble together various grants from different sources. Every one of those grants wants a little bit something different from the research that we're doing or the practices in which we're engaging. And so each one influences a slightly different outcome in the behavior of practitioners. I would say government funding in particular from governments in the so-called global north, that is, governments that historically were colonizing powers and now engage in neocolonial practices, inject a kind of neocolonial incentive into projects, research projects and practices. They look for results-based research with a strong funding preference for quantitative over qualitative data, despite the value that qualitative data has, certainly in social work, particularly in elevating the voices and experiences of people who may not have those by involving their narratives directly in research rather than insisting that data can speak for itself. I want to acknowledge the theory of fundamental causes from, which is a public health concept established in 1995. The authors of it later went on to describe socioeconomic as a fundamental cause in 1998. They said that low socioeconomic status correlates to multiple adverse health outcomes and acts through multiple pathways. I would argue that this is a direct result of neocolonialism and, in my opinion, neoliberal capitalism. If we do not address these economic structures, we continue to deny our fellows in the so-called global South the opportunities that we are afforded by the colonial actions of our nations in the past. And lastly, I want to acknowledge that I've painted a little bit of a cynical picture. I don't mean to be bleak, and I insist that I am not a pessimist about social work. I have great hope that as practitioners with a desire to serve our fellows in our local communities and in our communities around the world, you join me as I demand that we ask communities what it is that they want and need, when we demand accountability from the power structures that impose a capitalism-influenced neo-colonial mindset, including our own universities, and when we refuse to further commodify human need any more than it is already. I hope that I will see some of you out there as we trudge the road of happy practice and destiny. Thank you very much.
Thank you, Akiva, so much. And you are launching us right into a structural analysis. Rose, I want to ask you if you have any other insights or things to add. Akiva really set the stage for us having a discussion about the role of grant making and large social structures to perpetuating neocolonialism. Go ahead, Rose.
Good morning. In Kenya, it's in the evening, and I like the idea what Akiva, being one of the group members, what he has actually discussed. He has discussed most of the things that probably I don't want to repeat at this time. But looking at the structures, mine is a bit, what I focused about colonialism is about looking at the classical. When it comes to structures, we have the classical and the, and the settler, and the difference actually is like a circle and a line, whereby the classic will get the lion's share or the big cake, and when the settled ones will just get, they are the slavery, they are the people actually who serve on the ground. I want to give an example of a country like Kenya where I'm working, looking at how the structures are being done. For example, when it comes to like funding, the paper funding which comes through CDC, the organization which is actually my donor, funding does not come directly to the people at the ground. Funding goes through chains. By the time people are getting the, the support, they don't even feel it. There are so many people who have actually, changed things from above, and actually at the grassroots level, people are not benefiting. So the structures cannot be compared. The structures are not the same. I looked at also the system, look at the education system and look at the healthcare system. When we talk about education system, we even have social clusters. We have those people who go, to prestigious schools. We have those people who go to, the other schools, it's not balanced. And when you look, even the professionals, we've also encouraged that. And looking at the pre-colonial and this colonial, the history is repeating itself. Because actually, when you look at, this is a bright child, or these are bright children who needs to go to a good school, they're not being offered in terms of, they're not being offered, good education. I was looking at when it comes to like, for example, I want to publish a paper, those are educational professionals. When you want to publish a paper, you've written a journal, you've gone through that. You cannot do it on your own. You have, you have to go, we have a hierarchy that you have to start from the top so that at least your paper will be published. When you look at, how do I publish this paper? Even these journals, actually, they look at the people, where you are writing a paper, where are you from? Are you from the low and the middle income countries? They will even decide to give you, a journal where you're going to publish your work. You try actually to look at what you are able to do as a, as a student who is trained, who has all the education, but nobody is listening to your voice. In regards to what Akiva said about incentives, I was looking at this incentive. Even you look, the history is actually repeating itself. Look at the developing countries. I can give you an example. We have, Kenya is it has one of the largest, the slums that we have in Kenya. We have so many people, the white people, they're always coming to Kenya to look at these largest slum in Africa. We have over 400 non-governmental organizations, and actually they bring aid to Kenya. But when you look at that, you know, the slum itself, yes, we have donor funding is coming as a way of, you know, incentives. But, you know, it's not helping the people on the ground. Actually, the people who are getting that benefits are the people actually with selfish interests, the leadership, the political people, they have all self-interest. So the people on the ground, still, the poverty is still singing the same. And I've grown to hear about, you know, some of these things. And today I speak the same. As much as, for example, that place is getting funding, they are not feeling it. They are not getting that, you know, the funding directly. So those are some of the things probably I will look around that. Yes, they are getting this, but they are not benefiting. Yeah.
Thank you so much, Rose. Those are really just very important points to make. I really appreciate your comments about like getting published and how much of a hidden curriculum that is for people, honestly, right? As somebody that is pursuing my own graduate studies myself as a part-time student, I really, that's a very important point about access to opportunities to learn how to get your ideas into venues that where they're going to be read about and learned about. You know, that in and of itself is a very colonial mindset, as well as just the ways in which structures introduce money into countries, and it doesn't really have the kind of impact that we hope for people on the ground. Thank you so much, Rose, for those comments. Really appreciate it. I'm going to move next to the Malawi UMB Law Group, Teoka, Erica, and Asante. And for Teoka and Asante, we had a really fascinating conversation in the law group that one of the main points of discussion that was raised by the two of you is how legal structures are themselves based on history and precedent, which in the case of former colonies are basically inherited structures. I really want to ask you about an example about how this colonial past is creating issues for Malawi's ability to address its contemporary issues, and potentially reflect upon the role of lawyers in analyzing current laws and advocating for new laws that are more in line with Malawi's present circumstances and national identity. So if either one of you can start, that would be great.
Hi, everyone. So I'm going to take up the first part of the question, and Teoka will address the second part of the question. So I'm looking at how Malawi is was once colonized, and we're looking at issues, for example, health issues. I looked at how mostly during the colonial era, the health systems or the structures that were put in place during that time, I believe that they weren't mostly in favor of the people who are being colonized, but they were advanced by the colonial rules, and they were determined by the economic and social and political requirements of the colonialists. So for us as a country to continue to inherit and adopt the same structures that were there during that time, and to continue using them in this period when we're trying to be independent and liberated, it kind of gets in the way of trying to tackle the issues that as a country we face, because the structures that the times that the people were living during that time are different from how the people live right now. So if we're to have, for example, laws that are still addressing issues that probably don't even exist now, if we still have laws that maybe still make reference to pounds when it comes to issuing remedies and issues like that, and if we have the majority of laws not being in a language that half of the majority of the people in Malawi understands, then there's no change that we can be able to address if we're using the same laws. And I think it's one of the other issues that was raised by Dr. Agnes, that there are issues like language is still a form of colonialism, because you can't expect people to be able to address the problems that they're facing if the language that you expect them to use is one which they can't rightly articulate their issues in. So as a country, for us to there's still some conflict between the living customary laws, and if we're comparing them to even the laws that we keep on preserving, the ones that we simply adopted from the colonial era. So the more we keep relying on the structures that we simply transplanted from the colonial era to this era, there's no way we can be able to address the issues that we face, because they're two separate, the issues that are happening in two separate areas. And for us to simply rely on the things that we're using back then, it can't really address the issues that we have now. And my colleague Teuka will address how the legal experts can be able to maybe create a new identity for Malawi to be able to use. Thank you.
Thank you. You're muted, Teuka. Teuka, you're muted. Can you unmute?
Apologies for that. Hello, everyone.
Hi.
So let me perhaps begin with a famous quote in legal circles by Reynold Strickland, who once said that lawyers are foot soldiers of the Constitution. But can every country really, especially those in the global South, truly call their constitutions theirs? Can Malawi call its constitution hers? You know, Santi has given a very good example of inherited legal structures and how these pose a problem. And of course, this has been acknowledged, and now we have law reform agendas. But even when we critically examine the law reform agendas, can we truly characterize them as being free from colonial ideologies? Who sets the law reform agenda? Where is the money coming from? Why is the money coming? Is it in good faith? Can we call it charity? Charity without ties, without expectations, without Western ideologies? I think not. What are the legal principles that are permeating current legal thought? You will find that Western ideology is still so predominant in legal thinking. And so in a sense, current laws and even future laws can best be characterized as a form of neocolonialism. And the problem is multidimensional because on the one hand, we have substance of law that has colonial and neocolonial tenets, but also on the other hand, the application of the law itself is characterized by procedures that do not best reflect the context. And so lawyers can play such a critical role in ensuring radical law reform, but also shaping how law is applied. Lawyers are in such privileged positions to engage with laws in varying contexts. The opportunities that lawyers have to apply laws in varying contexts are such unique opportunities so unique and particular to the legal profession, you know, to observe and to examine the relevance of laws. Lawyers need to be trained to be conscious of neo-colonial realities, to challenge status quos instead of just accepting existing privileges and power structures, and even to take steps further to advocate for change, including the review of laws. And I know it sounds good, but it's not the norm. It may not be dignified, but it's high time that the Global South needs to step away from its historical categorization as the other in global matters. You know, conversations such as the one that we're having now are so critical, yet so rare. Lawyers need to be on the forefront of rethinking and redesigning legal education and training, the substance of laws, the way laws are applied in practice. Lawyers just generally need to be on the forefront of creating legal discourse that can generally be characterized as being relevant to the Malawian context and whatever context the laws in question are likely to be applied. So that's pretty much it. Thank you.
Ilka, thank you so much for that comment. And you segued me beautifully to the question of education, because I totally agree with you. Like the structure versus human agency problem is like the perpetual problem that we're talking about here. And how do we create the grassroots conditions inside for structural change is very much, I think, a question of education. So I'm going to transition to Erica here and ask you a little bit about your experience as a student in the collaborative course between UMB and Chancellor's College. This was a really fascinating course, in my opinion. So if you could tell us briefly a little bit about the topic and how it was particularly unique for you as a law student in terms of your experience in that course. And what do you think is the role of courses like this in the project of decolonizing global education?
Thank you, Amy. So great to be with all of you today. I really found this course, which was focused on environmental justice, human rights, and public health, to be incredibly fulfilling. And I'm not just saying that because I'm on this panel. It was really probably the most moving of my legal education so far. It was designed really effectively in that it was multidisciplinary and brought together speakers and educators across all of those topic areas: environmental justice, human rights, and public health. And each of those areas involve complicated and different values and legal principles. But in the context of Malawi, the health and well-being of the country is inextricably linked to environmental degradation and access. So in order to develop one and enrich one, you really have to take into account the others. The course, I think, reflected that interdependence, and in taking this approach also allowed more opportunities for us to consider the country's past experience with colonialism, as you've heard from some of my colleagues today, and how that impacts its approach toward health and the environment today. Just as importantly, the course was co-taught with Chancellor College in Malawi. So in addition to gaining this multidisciplinary knowledge, we learned firsthand from professors and students in Malawi who were wonderful and gave us deeper insight into the country's culture and value system. And I think that helped us to brainstorm really viable solutions. In my impression, this type of course helps to advance the field and decolonization within the field, because it brings together a variety of voices from different backgrounds, both from a topical perspective, but also those from different countries and even backgrounds within those countries, and engaged us in meaningful conversations where everyone felt free to share and be vulnerable in terms of their views toward the different topics. And in my view, that almost always leads to better and more inclusive problem solving. And then certainly for our US students, it was important to better understand global inequalities and remnants of our colonial past, both in Malawi and in the US. I would say that a more narrow approach on one sector or issue could not have captured the complexity of the challenges and opportunities that Malawi faces, nor the issues of environmental justice more broadly in such a way where we could actually develop tangible and creative solutions.
Thank you so much, Erica. Like, in a nutshell, what I really hear you saying is how important the interdisciplinary approach actually really was to this course, as well as like really hearing from students in that context and like taking a deeper approach to understanding the very nuanced and sophisticated issues surrounding context is just so important to the work of building equity and advancing more equitable distribution of resources, new systems, and to our own collective learning, which is just so powerful. Thank you so much, Erica. I really appreciate that. I'm good, and I feel like you've sort of set me up well for my question with Lindsay from one of the social work groups. And one of the topics that I heard discussed in your group was really the notion, and in other groups as well, was really around the notion of expertise, and particularly how do we decolonize expertise and incorporate what Dr. Long characterizes experts from experience into professional education and practice. Go ahead, Lindsay.
Thank you so much. I am going to share my screen. I have a very, very brief presentation. Let me make sure you can see it.
Thank you.
Can you see
Yep.
that?
Yes, we can.
Okay, great. Thank you to everybody who's already shared. I mean, yesterday and today, it's just so enriching and has kind of re-maneuvered our conversation and outline. So thank you. This has been just an awesome experience. So as you mentioned, we worked with Dr. Caroline Long, Sally Ann Bjornholm, Brooke Bainham, Bryn Herrick, and myself. So this will definitely have some continuity as all the questions have kind of naturally led to each other. And Akiva did a great job in capturing a lot of the social work principles, so especially in education. So in the interest of time, I don't want to be too redundant, but yeah, just the role of academic institutions in deciding who has that expertise and who doesn't. So just bringing awareness to the classroom to challenge that frame of thinking and recognizing the white-centered curriculum and policies. So integrating those topics of oppression, colonialism, diversity, and resisting the temptation to assimilate students to the current culture of higher education, and instead empowering them to thoroughly critique these standards. So, you know, having them be very, very critical of everything they're learning and not accepting the status quo and being an agent of change for that. One of the things that UMB does really well is I just finished my foundation year, and we began our foundation year with a structural oppression course. And that really helped before we got any further to set the historical context and really explain and do a good job of seeing through the lens of power relations, privilege, colonialism, systemic racism. So it was really, really helpful for myself, especially as a clinical student, because it's so applicable to both specializations. Another thing that's important for educational institutions is to collaborate with global colleagues in genuine partnerships, foster those relationships, even though they may take time and investment, which isn't a very quote unquote Western way of thinking, really making that investment because we like the quick results. But supporting interprofessional global education that goes beyond this medical diagnostic model. And then especially in social sciences, teaching about changes in research methods over time, especially as it relates to different types of data. So like health disparities, and Akiva went into the value of qualitative research when we're so quantitatively based. So, and then as an individual commitment, as a student, just dedicating oneself to a lifelong learning of self-awareness, recognizing the impact of their or our social identity and our position in practice, understanding and dismantling that privilege and strengthening our cultural sensitivity. And this continuous self-appraisal of our own scripts and implicit biases. And let's see, I'll go to the next slide. So even beyond the classroom, starting all the way at the top, the discrimination with institutional leadership, we have a code of ethics in social work, and that in and of itself, even though it's an international code of ethics, lacks, fair representation. And it's based on Western views and individualistic values. I put Western in quotes because I learned yesterday that that's not technically, we should be turning the changing the terminology. So I'm constantly learning and unlearning, what's right and what's wrong. So that's just, I don't have another substitution to use just in this context to get the point across. But the patient-centered model is not necessarily generalizable cross-culturally, and that's a very individualistic way of viewing things. And many of these communities are interdependent. They don't see themselves as very separate from their environment, and it's hard to isolate those conditions. So we really need to build genuine relationships and work through, as Akiva mentioned, the qualitative data to understand what they believe the issues to be, what they want help with, instead of assuming we know. That's a very missionary white way of thinking. let their voices set the objectives and the goals of the work. Because we value, going back to funding, as others have mentioned, like we value the results, instant outcomes, scientific method. That's what determines the funding and the agenda and how the results are presented. So, you know, whoever's pushing that process, who's sponsoring the study, who's going to benefit from the results. So just keeping that in mind and really valuing the qualitative and anecdotal, you know, research from the beginning to move more towards the, you know, results that we're trying to, the evidence, and increasing the integrity of the evidence, as Dr. Sal mentioned, because that's what's going to make it the most efficiently, maybe not efficient, effectively actionable, because we're getting the evidence from the experts. And I'll go a little bit more into the experts. And then one quick thing is that psychological research, you know, and social work, which is supposed to reveal truths about human psychology in general, it really only captured, at the beginning at least, a very thin slice. It's people who live in Western, educated, industrialized, rich, democratic nations. So they call that WEIRD, W-E-I-R-D.
Yes.
I didn't change slides. This is my social work as a profession that I just talked about everything. So here's a little summary. But yeah, I like the WEIRD nations, because really that helps us to evaluate where the research is coming from and who it applies to. So that is that slide. Let me remember to change slides this time. So now bringing us to practice. We were encouraged in one of yesterday's sessions to think of culture, history, legacy of our particular profession or discipline, and how that impacts how we learn, interact, and trust information. So social work has a history of hegemony, or what might be called professional imperialism in other countries. And that's, again, sharing our values as best practice, assuming that we know what is best based on our value systems. So a good way to counteract this and challenge this is to look beyond the clinic and into the community. So some of these conferences held are in a completely different region and the problem exists, right? And so the Global North is deciding what's best for the Global South without even incorporating them into the conversation. It's also important to understand what culturally appropriate means and who is setting that norm, because there's gatekeepers within those communities with power and leaders and values tied to money, so that they're affecting what people believe, and people might not believe that they need help because of these, for example, gender constructs. I'll go into that a little bit later. But so this experts by experience notion in social work and interdisciplinary education are much less common in the US than other countries, particularly in roles of authority. And so in the US, they mostly serve in advisory capacities. So we really need to bring in the lived expertise on authentic conversations, diversity, firsthand knowledge about the enablers and barriers to successful outcomes. So this was brought up earlier this morning, but they need to be treated the same financially, level of respect, understanding, dignity, in order to have those conversations and bringing everybody to the table. So as a decolonization strategy, we recommend these experts by evidence in significant roles: teaching, decision-making, manuscript preparations, research, funding discussions, IRB panels, and really amplify and value their voices instead of using the external forces to guide the research. Community-led monitoring can help with this. For example, PEPFAR and USAID are some global health examples right now who are really working towards that goal. Working with the community instead of for them. So helping them find their voice and then supporting them to create change. And again, time is required for these relationships in order, to make sustainable changes. And then qualitative research is important, as we've kind of gone over. So the what now? what do we do now? That's a big question of the day, right? So it's a balancing act. And in social work, in general, there's always like this battle of finding the balance between macro and micro, because if you're solely focusing on micro and clinical work, then you're kind of feeding in and perpetuating that blaming the victim mentality and ignoring the larger systems at play. So macro, alternatively, you might be looking at the overarching policies, but you're not necessarily helping the people, on the street level who need help right now and the immediate benefits. So balancing health equity with the human rights framework is also really important. So helping those that you're trying to help to be involved in the macro level goals and priorities and helping them set those agendas. One interesting topic, and I'll close with this, we talked about how the oppressed might not realize they're oppressed or want to seek help. For example, women who are comfortable with their role or, have always seen it as appropriate for men to be leaders. So if there is a system of oppression, it's the duty of the social work practitioner to empower the oppressed and break the system by helping them to do so. So that's where the grassroots efforts come in. And then think about why they find these practices to be culturally appropriate, and then who instilled these beliefs and norms in the first place. Actually, this is my last thought. So Dr. Opera so eloquently yesterday explained the broader concept of, decolonization of the mind and liberation beginning with imagination and looking within individually and institutionally. And with social work in particular, it's important to recognize that this decolonization not only refers to removal of the domination of external forces, but also the decolonization of the mind from these ideas and what makes them feel inferior. And this entails authentic conversations as well as rigorous self-inquiry in order to help the clients in the population work to change their inner narrative and their narrative as a whole and empower them to create and sustain change. So those were the most concrete suggestions we could give based on this conversation. So thank you so much for letting me share.
Thank you, Lindsay. Really appreciate it. I'm going to move on briefly to Sarah, who is the representative of the public health group. And I understand that your conversations there were very engaged in a conversation about menstrual justice and the relationships between colonization and gender inequity. What can decolonial movements learn from struggles for gender equality? And how does gender equality interact with decolonization as you see it, Sarah?
Thank you, Amy. I would like to first thank you, our team, and Dr. Elizabeth Moring and Dr. Madhu Kushwaha, and my peers, Rava, Sarah, Sudan, and Akbar for their inputs during a workshop that we had last week. We had a great conversation, and I hope to convey some of the points that we discussed as a group, as well as some of my own personal opinion about ministerial justice and decolonization. I will first speak briefly about the issue of ministerial justice, and then I will discuss how gender equality interact with decolonization. And I will keep it specific to my topic since I think the general concepts have been already very well explained and discussed. I loved Lindsay Wanger's presentation. That was amazing, especially about talking to focus on structural changes as opposed to blaming those who are already in need. So ministerial justice is a significant public health issue around the world, especially in the global south. A student drop out of school or miss school during their menstruation period. For example, in India, 1 in 5 students drop out of school, and in Afghanistan, it's about more than 1 in 2. While for some it's due to a stigma, for others it's because of the lack of poor toilet and other facilities in the school. Because of the stigma and practices that has institutionalized menstruation as a taboo topic, women and girls are less likely to practice proper hygiene and seek help or medical care when they need, and therefore are more likely to be diagnosed with other severe diseases, including cervical cancer. even in places where it's not taboo to talk about menstruation, there's still a lack of awareness among men in families and the society at large. In countries where women work on the farms all day, do not get to rest even though when sometimes they are bleeding heavily and are in need for taking a rest. There also exists unequal access to sanitary products such as pads and tampons, and many families around the globe cannot afford to buy those products. And finally, again, the stigma, shame, and some other unjust practices has really exacerbated patriarchy and consequently increasing gender inequality. So our group also discussed the fact that although the Global South doesn't like interventions that are condescending and undermines the culture of the Global South, this does not mean that the Global South is okay with gender inequalities and doesn't mean that they do not need help. We, the Global South, I mean, I was born in Afghanistan, and so we do need help with building our capacity. However, interventions need first to examine the community context, sociocultural norms, and power structure. And second, to engage with community and religious leaders and build the agenda with them instead of going with an agenda already created. And I think Lindsay has already done a great job of explaining this. Also, furthermore, when the Global North attempts to assist the Global South in reducing gender inequality, they also need to understand the historical context of that country. And as an example, and this is going to be my last example, and I'm going to talk about Afghanistan because that's the country that I was born in and I know very well. And just to give it an exact example of why it's important to understand the historical context of a country before intervening. So in Afghanistan, majority of women do not have basic rights like getting an education that's only granted to men, and 56% of women experience spousal violence. But this does not mean that Afghan men are innately violent. Before Afghanistan was invaded by the Soviet Union and by the US, which was before 1970s, women in Afghanistan had the same freedom and rights as women in the West. Had we not experienced colonization, invasions, and war, we would have developed the same way as other developed countries have progressed. But the invasion, colonization, and the continuous war has created a structure of violence, which is defined as indirect violence built into repressive social orders that can shape people's self-conception, behavior, and practices. Conflict also robs people of opportunities for education and employment, leading to poverty, inequality, oppression, and stress, all of which induce gender inequality. For developed countries to intervene by implementing short-term programs or establishing laws that support gender equitable laws are not enough, especially when those laws are not enforced. There is a need for empowering those countries in the Global South and building their capacity and providing them with resources so that they can become independent and stand on their own feet. And the Global North need to do this with a decolonizing mindset and with an active involvement of the community members. And at the end, I want to conclude by saying that not all interventions and help are malintended. There are certainly countries and organizations that have genuine interest and goodwill in helping other countries in need. We just need to bring awareness about the way the Global North approaches Global South, and just to be very careful about the nuance of being more sensitive to the cultures, being more aware before we step in there, because again, even if the intentions are good, but if it's not approached properly, then the people in the community will feel, they will resist basically, and will be feeling, like condescending and, which is something that we do not want. So I really like to emphasize on the aspect of bringing awareness and really engaging the community. Thank you.
Thank you so much, Sarah. Those are two outstanding points to reiterate for us, because it really does speak to the role of really trying to understand historical legacies, but also really trying to think hard about how we are present in communities around the world, right? And really thinking about how we listen deeply to voices inside communities to learn the best ways to do things in that setting, which has been a through line across the summit. Thank you so much. So I'm going to transition now to the School of Medicine and the physician assistants representatives, Michael and Danielle. And I understand, I was in the PA session, I was not in the School of Medicine session, but I understand that both of you spoke about a scenario about, a particular scenario about short-term experiences in global health. You know, Dr. Opara really called out the use of the term medical missions in yesterday's panel, so let's be mindful of our language. But I understand that you had a discussion about the role of these STEGs, if you will, and the ethical conundrums that come up around the presence of international students and trainees and organizations in limited resource settings. So I'd like for you to share your reflections about what some of those ethical dilemmas are and what you would say students, trainees, and universities can do to advance greater equity and think about their role inside of low and middle income countries. Danielle, I see you're unmuted, so if you'd like to kick us off, go ahead.
Sounds good. Thank you, Amy. And thank you for everyone who's presented today, such powerful topics. First, I want to thank Dr. Kimberly Bazell and Professor Nicole Wooten, who were our faculty advisors. And I'm also speaking on behalf of the PA program. And our group was Alex Berinsky, Dorian Hoffmeister, Francesca Mertan, and Tiffany Ligon. And we just have to say and be upfront that many of us in our group are guilty of this. We had gone on mission trips. However, we did realize after we went on our mission trips that we tended to get more out of it than we gave back to the community. And yesterday, as many of the panelists spoke and experts spoke, that we're actually doing more harm by these mission trips than doing better. So I will touch on that. But one of the main dilemmas we first discussed was how mission trips, and I'm going to use the term just kind of classically here, they're pretty unsustainable. So we use the term a Band-Aid to represent how these trips provide a short-term fix, so we think, to the larger problems at hand. So the bigger issues here are the lack of resources, be that human or physical resources, and the inability of many in these remote communities to travel to cities that actually house most of the healthcare access for their country. So we're trying to discuss ways to promote sustainability in these communities. So instead of coming in and acting as pseudo healthcare providers for a week or two or three, and then leaving and stripping the communities of the human resources we had just provided, we really thought it would be better to establish training programs and mentorship programs. So therefore, we can leave behind the skills and the knowledge that we as students or as doctors or PAs have learned. So initially how we see these programs going is first establishing partnerships with other universities and communities in the Global South to really build relationships and truly understand their culture, their current healthcare system, their healthcare roles, and the needs of their community. So we are one step in this direction with this conference and the conversations we have had during our pre-summit workshops. So I really thank UMB for that opportunity. But we do need to go a step further and continue to collaborate with our partner programs in order to empower them and empower the locals to set up sustainable training and mentorship programs suited to their needs. And what this does is it also tackles a part of, we can be part of that conversation here in the US so that we are still learning and becoming culturally aware. So this could really start with simple mentoring. So a discussion I was a part of with the Maryland AHEC, or the Area of Higher Education Center, was the importance for children, the future leaders of the community, to see and talk to people of similar color and background in healthcare positions. So we could partner with the universities and communities to help start the discussion and establish formal mentorships so children of local communities can learn about the path into medicine and become passionate about giving back to their own communities through medicine if they desire. So therefore, we're still part of the discussion, but the children have a more realistic outlook and understanding of healthcare in the communities. And this could potentially increase a generation of healthcare providers, and that could tackle one of the big issues at large of getting more healthcare providers who understand the community and stay in the community. As for the training portion, we didn't want to jump too far ahead with how we see this initiative coming to fruition before really engaging with the community, as what we've learned through our workshops and through this summit so far. But we really think is important to consider is, one, who we train, and two, what skills or knowledge we can train. So that way the people can safely and adequately care for their people. So for example, I have a mentor whose family still lives in India, and he told me he has an uncle who is a doctor of his very remote community, hours away from the city. So the reason I put this in quotes, that this man is not officially a doctor. He never went to medical school, but through lived experience and through informal training in the city, he was able to come back to his community and care for the lower acuity patients. So he understands their culture. He understands what medicine they believe in and what medicine is best suited to tackle local prevalent diseases. But he knows his limitations of who needs medicine. And this brings me to my next point. Whereas physician assistant students, we believe strongly in challenging the hierarchy of medicine. So our PA profession was founded because people in the US Coast Guard were trained to provide healthcare on merchant ships during World War II. When they returned after the war back to the US realized we could turn their training or their lived experiences into a culturally and legally accepted healthcare profession. Since the start of the official PA profession in the 1960s, the profession has made amazing leaps. However, the Maryland Board of Physicians is now, and I mean now to this day, recently, this year, is trying to limit our scope of practice, restrict what we can and cannot do. But for what reason? To maintain the hierarchy? Are patients being harmed? And we really think that, and I hate to use the term ego, but at some point, some people want to maintain this hierarchy. They want to maintain their power. They don't want to lose the power they have on the medical system. And actually our UMB AACC Assistant PA Program Director, Professor Teresa Newman, was fighting for the hierarchy, or to dismantle the hierarchy, last week with the House of Delegates to fight for the future of our profession and fight for our school's mission of producing providers to bridge the healthcare disparity gaps. So limiting PA scope of practice will ultimately unequally harm those in underserved areas who already have less access to healthcare. And in yesterday's discussion, Dr. Dania spoke about this healthcare hierarchy that stems from the consequences of colonial mentality, where physicians are the highest source of medical power. They are the bosses. And yes, we respect a physician's level of education, their commitment to medicine, their role in medicine. Their expertise in distinct specialties is critical for many people, especially patients of higher acuity. However, as there is an ever increasing need for healthcare providers in the United States due to the increased multiculturalism and the diversity we're welcoming, Or in the global south, where people are still dying from many preventable diseases, we want to challenge this hierarchy. We need to reshape our healthcare systems in each country and in each community to promote increased access to affordable healthcare.
Thank you so much, Danielle. These are all very powerful points. I want to give a chance for Michael to chime in and also talk about what the School of Medicine group was talking about. And I know you have some insights on this from your work in Samoa. So Michael, please go ahead.
Thank you so much, Amy, and thank you to each of my colleagues who have spoken before me in this panel. I've been taking extra notes and saying, okay, I need to cross this out. It's already been said so eloquently and well. So I will add only brief comments in the interest of time, but to emphasize a few perspectives that are not unique to medicine in any way, but something that we start with in our curriculum. On the first week of orientation, we talk about medical ethics, and four that are pillars in medicine and across all these fields are autonomy, beneficence, non-maleficence, and justice. And these hold true in our education and in our practice, hopefully and ideally, but at some point sometimes seem to leave when individuals leave the system in our country. And the scenario we talked about hits upon all of these. I won't summarize the scenario in its entirety, but essentially a second-year medical student paying a large sum of money to do a one-week trip to Johannesburg, South Africa, where they worked for a made-up organization called Help the Hurting. And when they returned, they posted about it on social media about how it opened their eyes and changed their life, and etc. And there are very clearly systemic effects of colonialism and neocolonialism on this scenario. And unfortunately, this scenario persists in many examples today. A few points that we pulled out were, for example, predatory branding. The name of this made-up organization that is very representative of many, Help the Hurting, focuses on a deficit-based unilateral action where you have this savior coming to help. And it preys upon sort of the interest in all medical professionals across all allied health fields to help. That is part of our training, but not necessarily in a fair way in this example. With a student paying very high costs, the question that was very eloquently brought up by Rose early on is, are these funds reaching the people on the ground? Or is there some intermediate party with self-interests? Why are the costs high for a student to visit for 1 week? And the student, while they were in Johannesburg in the scenario, performed procedures for which they were unqualified, such as delivering a baby under nurse observation, which they never would have done in the United States. And so there are questions as well around that. But I think a more salient point that is extremely important brings about the danger of a single story, as so eloquently put by Chimamanda Ngozi Adichie. And she talked about how one perspective, one moment, one story will not be beneficial in the long run. And this student, after returning, saying how it changed their life, this one experience, it's not representative of Johannesburg, a single clinic that is in desperate need, having students performing procedures that they should not, is not representative of probably the dozens, if not hundreds of other excellent healthcare outlets within Johannesburg and local efforts that are trying to improve. And the fact that a student would attend or arrive and be completely surprised by conditions at a clinic really shows a lack of preparation on the organization side to make sure that that student is truly aware of what they're going to be working with. And to sort of wrap up our reflections, the most, I think, important question that came up was prompted by Dr. Fayron Guzman about the potentially detrimental good work, the potential detriments to the good work of a clinic and the physicians and nurses and staff, clinical staff who are there all the time and not coming and going. And Dr. Danya Kato yesterday remarked on the ethos of better than nothing, questioning whether, is this better than nothing, you know, spending this money and going for 1 week. And there are detrimental long-term effects on a local ecosystem, as she so eloquently put it. And most of those times the ecosystem is ultimately cared for by years of hard, slow, incremental work by local leaders not by a 1 week experience for a student that returns and the major reflection is that it changed their life. So to summarize a few, I guess, specific, I think, attitudes that students, trainees, and universities could put into practice, I think Danielle put a lot of excellent points out there that are actual structural changes that could be put into play. So I'll take the side of some attitudes. We feel, a student should put it upon themselves to prepare. Like Dr. Opara said, ask why 5 times and be prepared with the humility to not know the answer and the humility to be in a position of learning from someone, even if you do not know their educational background or their experience. They are there and they have been there before you. So you must go with that humility. And that's an attitude that can be cultivated through academic programs in your local institution. For example, in the School of Medicine, we have service learning, and service learning is not just the hours put into it, but it should be the development of that Y times 5 at least. Seeking research projects can oftentimes be more beneficial than a 1 week clinical stay, because a research project requires previous literature review and understanding, bringing some small skill set that's beneficial, ideally at the request and at the behest of the local organization, and then follow up and working through it after the fact that you leave and continuing to contribute back in that circle versus a line that was discussed. And at the university level, going all the way back to Dr. Ward's opening remarks, I think he put it great, celebrating the richness and expertise of international students, scholars, and faculty can be actualized in so many ways that Danielle and Lindsay discussed. So I will leave it there. I know that we could discuss this much further, but in the interest of time, thank you all for your wonderful, wonderful remarks.
Thank you so much to this amazing panel of students. I'm beyond proud and grateful to have learned from all of you in the last hour, and I'm sure our audience feels the same. I think I'm going to transition us back to Carlos, if I'm not mistaken, but I want to say thank you, and this was just an amazing and inspiring panel, and I'm looking forward to building on the ideas that we've advanced here today. Thank you.